Hit record and admit everyone from the waiting room.
Welcome. Give it just a second. We're going to let everybody get settled in and we'll get started in just 1 minute. Great. I think we've got a lot of folks in and hooked up and ready to go. Thank you all for being here today. Thanks for joining us for Roadblock, Navigating the Benefits Cliff for Social Security, Disability Benefits, and Employment. This event is made possible through a partnership with UpLift, the Central Iowa Basic Income Pilot, the Harkin Institute, and of course, the star of the show, Disability Rights Iowa. Before we get started, there's a few things we wanted to go over for you today. If you can make sure that your Zoom name reflects your registered name, that will make sure there's no delays or issues with the CME processing. There we go, and we've got it up on your screen, a couple of reminders. Also, if you can just do us a favor and make sure that you mute your microphones during the presentation today, that will make sure everyone can hear. You'll see that today's webinar is being captioned by Jamie. We have ASL interpretation provided by Jennifer and Michelle. They are spotlighted on your screen, so they should be easy to see for you. We also will be taking questions, but we're going to save those for the end. And so you can submit your questions through the chat at the end of the presentation, and we've carved out time so that all of those get answered. Also, in order to provide the most relevant and meaningful conversations, we ask that you please complete our survey at the end of the event. We will put that in the chat and we will email that to you as well. It really does help us improve the conversations that we put on. Also, all attendees will receive a certificate of attendance for the continuing medical education credits being provided or a certificate of attendance. And so make sure once again that your names match your registration. Awesome. Now that those are out of the way, I want to introduce myself. My name is Ashley Ezio, and together with my colleague, Michael Berger, we make up the project coordination team for UpLift, the Central Iowa Basic Income Pilot. Today's webinar is part of our efforts to engage the community in meaningful conversations around economic stability and community well-being. If this is your first time joining UpLift's Community Conversation series, we invite you to get involved, subscribe to our newsletter. That way you can make sure that you always have a voice in our conversations. In case you haven't heard of UpLift, I wanted to give you a brief overview of the pilot. UpLift, the Central Iowa Basic Income Pilot, is a community learning opportunity brought together by 11 funders representing corporate, public, philanthropic, and private entities, all dedicated to finding innovative solutions to poverty. As a randomized control trial, the study has 110 participants receiving a monthly income payment of $500 for 24 months. Another 140 participants agreed to serve in the study's control group. They do not receive the monthly payments, but their experiences are used for a comparison. Research and evaluation efforts are led by the researchers at the University of Pennsylvania and Des Moines University, with project coordination efforts led by the Harkin Institute for Public Policy and Citizen Engagement at Drake University. This study gathers scientifically valid data from the experiences of our local Central Iowa community members across the Tri-County area of Polk, Dallas, and Warren counties. The pilot includes participants from over 20 communities, including rural, micropolitan, and metropolitan areas. Beyond our research study, UpLift is dedicated to curating a community-wide conversation about poverty and potential solutions through the UpLift Community Conversation series. Our partnership with Disability Rights Iowa has been crucial to curating these conversations about social safety net programs and their effectiveness. Today, we're so excited to partner with the WIPA team to bring you this webinar focused on navigating the benefits cliff for Social Security benefits and employment. Now, I have the honor of introducing the Disability Rights WIPA team. First, I'm going to start with Misty Johnson. Misty graduated from Walden University with an MBA. She follows her passion for serving people with disabilities both personally and professionally. Having several family members who live life to the fullest every day with disabilities, she works tirelessly to ensure that they have a voice through the strong connection with disability advocacy. Previously, Misty worked to reduce employment barriers for transition-age youth and young adults with disabilities by collaborating with local employers while working as an employment training specialist with the WIA Youth Program. Misty also facilitated an employment network, providing support for Ticket to Work program participants, and is a former disability navigator under the Navigator Grant for Iowa. Next is Jenny Lyons. She is a community work incentives coordinator. Jenny's passion for social justice is influenced by her parents who are employed in the fields of higher education and social work. Prior to joining the disability rights team in 2021, Jenny worked in a number of roles at colleges and universities, including accessibility and disability services, admissions, orientation, financial aid, and academic advising. Her most recent role was the Student Accessibility Services Coordinator at the University of Northern Iowa, where she oversaw the day-to-day management of the department while supporting students connected with the SAS. Through her time in that position, Jenny advocated for greater accessibility and inclusion for individuals with disabilities across campus. Highlights of her time with SAS include organizing the 2018 Iowa Regions Disability Summit, Self-Expression of Individuality, and the Groups to Which People Belong, transitioning the department into a social justice philosophy, and implementing an online case management system to better support students, faculty, and staff. As a community work incentives coordinator, Jenny counsels beneficiaries receiving Social Security disability insurance and supplemental security income based on disability and the various work incentives and other supports available to them. Jenny enjoys breaking down the complex and often confusing regulations for individuals to ensure they have access to take full advantage of their rights. Jenny enjoys staying active through kayaking and cycling, being the go-to foodie for the Cedar Valley, and going on adventures with Remy, her yellow lab. And last but certainly not least is Tammy Crouch, who is also a community work incentives coordinator. Tammy received a Bachelor's of Science degree in Human Resources Management from Bellevue University. Her previous experience includes working as a disability navigator, employment specialist, and disability resource coordinator with an emphasis on benefits planning for beneficiaries receiving supplemental security income and Social Security disability insurance. She received her Community Work Incentives Coordinator certification from Virginia Commonwealth University in 2014. Tammy has also had the opportunity to be involved with many projects related to Ticket to Work, Iowa Medicaid waivers, Iowa Vocational Rehabilitation, and Workforce Innovation and Opportunity Act. She's very active in her community and serves on several committees that work to address the barriers to housing, transportation, education, and employment-related situations. She enjoys science fiction, astronomy, and spending time with her family. Misty, Jenny, Tammy, we're so excited to have you here today. Let's dig in.
Well, thank you so much for having us, Ashley and Michael. We are very excited to be here and talk about a topic that is near and dear to our hearts and the work that we do every day. Just to highlight before we jump in, our disclosure information, since this is for CME credit, this information is provided in this activity for continuing education purposes only. This isn't a substitute for any health provider's independent medical judgment, and we are not receiving any financial benefit from this presentation from any pharmaceutical or other medical device company. So just a brief overview of our agenda today. We're going to provide an overview of Disability Rights Iowa, where the three of us work, and an introduction to the WIPA program and benefits planning. Tammy's going to take us away to talk about BENA and navigating SSI benefits. And then Misty is going to talk about MAT and navigating Title II benefits. And then at the end, we're going to talk about how you can refer clients to us for benefits planning support, and then leave time for any questions that you have. So for those of you not familiar with Disability Rights Iowa, we are Iowa's protection advocacy agency. That is a designation by Congress, and every state has a protection advocacy agency for individuals with disabilities. While we do have 8 federal grants, we are an independent nonprofit law center. We are not connected with a specific state or federal agency. We provide free legal advocacy assistance to Iowans with disabilities, and that encompasses all types of disabilities and all ages across the state. A couple examples of the different services and areas of support that we can provide: obviously, benefits planning assistance. We also offer direct individual legal and systems change advocacy across the state. We provide education and empowerment resources for individuals. We do have rights through our grants for investigations and monitoring of various facilities. We have outreach and training opportunities to help educate the public on our resources and individuals' rights. We have a representative payee program where we can provide oversight for that Social Security program. And then finally can offer a variety of technical assistance for different individuals with questions about their rights under the ADA and different resources that they can provide to their clients. So we are representing the WIPA program, a mighty team of 3, or the Work Incentives Planning and Assistance Grant. Now, this is a grant from Social Security, and we provide individuals planning to individuals who are receiving a Title II disability benefit or are receiving supplemental security income due to disability. And we'll touch on what that means in a moment. We can work with anyone from ages 14 all the way up to full retirement age, which this presentation is in 2024, and as of right now, that's age 67. And work has to be part of that conversation. So it could be someone currently engaged in work through wage or self-employment, someone who has a current job offer, or they're just at that very beginning of the road trip thinking, I want to work, what is going to happen, what are my options? While Disability Rights Iowa covers all 99 counties of Iowa, our WIPA project, that additional 9th grant, covers not only those 99 counties in Iowa, but also 34 counties in Northwest Illinois. I know we have a variety of different states represented in our presentation today. So if you are interested after this presentation, understanding who covers your state, please feel free to reach out. We can help you look up that information since there is likely a WIPA project either based in your state or covering part of your state like we cover Illinois. So the WIPA project, what is our goal? What are we trying to achieve? There's a lot of misinformation about what can Social Security disability beneficiaries do regarding work. Our ultimate goal is to help increase employment outcomes and increase economic self-sufficiency for those clients that we work with. We're not saying this is how much you should work, this is what field you should work in, but helping connect people not only to resources within Social Security, but then also across the employment continuum. Maybe if someone needs help with job support, finding a job, we can get them connected to different resources to help them. And ultimately want to enable beneficiaries to make those educated decisions about employment that meets their needs and their interests. So today you're going to be seeing the graphic on the screen. It's an orange triangle with an exclamation point, and that's to help prepare for some roadblocks ahead. As I mentioned, employment is 100% an option for Social Security disability beneficiaries, but navigating that complex system brings up challenges along the way. And it can really discourage individuals from working, even not even getting to the point where they're pursuing what options might be there just from that fear. So we want to highlight what resources are available, but what pitfalls are they going to hit across the way that might disencourage them. For a little just brief primer on benefit types so you feel confident going through this presentation, a Title II benefit is one that we're probably most familiar with. That's where someone has worked enough to hit those insured credits with Social Security. Now, they could have a Social Security disability insurance benefit, or SSDI, where that is a benefit they've pulled from their own work record. They could be a child disability beneficiary, or CDB, where they're pulling that record from a parent and they were disabled before age 22. Or they could be a disabled widow beneficiary where they're pulling a benefit from a deceased spouse's record. Now, under the Title II umbrella, the individual could be receiving an auxiliary benefit for any dependents based on their benefit amount. Now, with a Title II benefit, or you might hear us often say SSDI throughout this presentation, there's different benefit amounts depending on someone's work history. So if someone worked for longer periods of time or they earned a higher salary or wage in their job, they will likely see a higher benefit amount. So just because someone's getting a Title II benefit does not determine exactly what their amount is. With that Title II benefit comes Medicare after 24 months. There are a few exceptions, but for the vast majority of people, there is a wait for Medicare for 2 years. Now, the other side of the coin is Supplemental Security Income, or SSI. Now, SSI does not come with any auxiliary benefits for dependents. It's solely that person has a disability and they're getting a payment for themselves. There is a maximum federal benefit rate, and so across the board, regardless of where you live in the United States, you will have the same maximum benefit amount. We do have the 2024 and 2025 numbers on our screen. Just a reminder, if you are viewing this outside of those years, please look up your correct year's benefit amounts. For 2024, if you're an individual, you can receive up to $943 a month. And in 2025, that will be going up to $967 for an individual. There is a resource and asset limit, $2,000 for an individual and $3,000 for a couple. And finally, in Iowa, that automatically comes with Medicaid. If you're outside of Iowa, your state could be a little different. So you'll want to look into that since with SSI, it's not automatic in every state. So just a little background to benefits planning to help understand when Misty and Tammy are talking about our work, what is some of that process that is happening behind the scenes? One of the most important things that we obtain is called a benefits planning query, or BPQY. Now that contains comprehensive information about an individual's benefits and what work is on their record with Social Security. Some of the things that are important in that report are the status of someone's cash benefits. Are they currently in pay status or are they suspended? The work history that Social Security has on their record, what health insurance that beneficiary might be receiving, when their next scheduled medical review is, and if that person has a representative payee. So essentially, this one report is providing just a brief snapshot of what in that point in time is in Social Security's records. Now, this document is so important for two major reasons. One, as you'll see today, the two programs that we're going to talk about, Title II and SSI, have a different set of rules to what happens with your benefit when you work. So of course, we don't want to provide incorrect information to someone. So if someone is telling us that they have an SSI benefit, we want to make sure we confirm that with Social Security before we go in depth on what is going to happen with their benefits. The other great thing about this document is an opportunity for us to cross-check the record to make sure it's correct. Someone could be telling us, yep, I have worked for the last 2 years. And if we get that BPQI and it says that person's never worked, it gives us that alarm bell of we need to get this record updated before we can really go in talking about benefits planning and what will happen. So it gives us that opportunity to make sure everything is correct on that record. Now we're going to jump into two real-life scenarios for Iowa families who are receiving Social Security disability benefits. Now, I will preface that we have made these very simple just for the lack of time and knowing that we could really go on a lot of different rabbit holes, but really want to give you a snapshot of if we're working with someone, whether it's SSI or Title II, what is going to happen with their benefits and some of the issues that they run into. So I'm going to turn it over to Tammy to start with Benna.
Hey, everybody. So we're going to talk a little bit about SSI, and we're going to look at a scenario about Benna. She's 20 years old, lives in Ankeny. She recently secured her first job as a receptionist for a local nonprofit. She also just moved into her own apartment and lives by herself. She wants to know what will happen to her SSI, her Medicaid, her SNAP, and her HUD housing. She receives SSI at the maximum amount of $943 per month and she's going to earn $2,000 per month in her new job. So Benna receives $50 per month in SNAP benefits, and her rent is $250 per month with Section 8 housing assistance. And we're going to talk about her questions in the scenario. Next slide, please. So we're going to talk about our first roadblock, which is understanding the SSI calculation. So next slide, please. So with SSI, Social Security does not do a dollar for dollar reduction when someone goes to work. SSI fluctuate based on how much someone earns. And what they do is called an earned income calculation, which we're going to discuss. There's also other work incentives that are involved that can reduce someone's countable earnings and keep their SSI from being reduced. And that one of them would be called an impairment-related work expense. So what an impairment-related work expense is if somebody has something that they're paying for out of their own pocket that they need for work that's related to their disability, then sometimes we can ask Social Security to count that as an impairment-related work expense and not have them deduct that cost off their countable earnings so that their SSI is not reduced by a certain amount. Another work incentive is called a PASS plan, a plan for achieving self-support. And what a PASS plan is if somebody has a goal that they're saving for that they need for work, then sometimes we can create a plan that's approved by Social Security that allows them to save for that specific goal and keep their SSI from being reduced. Another work incentive is called a student earned income exclusion. And what this is if somebody is 22 or under the age of 22, sometimes a student can get an exclusion from their income to keep their SSI from being reduced. And that's $2,290 per month or up to a yearly maximum of $9,230 for 2024. So if somebody qualifies for student earned income exclusion, they're receiving SSI and they're working, that is a great work incentive to keep somebody's SSI from being reduced. Another work incentive that we're going to talk about today is 1619B, and that's a Medicaid work incentive that we'll go into in a little more detail. And a blind work expense, or we call a BWE, that is a lot like an IRWE for someone who has a blind diagnosis, Social Security blind diagnosis, but has a little bit more involvement, a little bit more than it covers than an impairment-related work expense. So next slide, please. So what is a general income exclusion? So the general income exclusion and earned income exclusions, basically what they do is they disregard a certain amount off of a calculation to determine what someone's SSI amount will be. So the general income exclusion disregards the first $20 of unearned income. The earned income exclusion disregards the first $65 of earnings. And then we do the calculation plus 1/2 of the remainder. So this calculation is often confusing for SSI beneficiaries. It's easy to incorrectly assume that a reduced SSI payment due to working results in less income overall. When it comes to the SSI calculation, if you have any questions about how your SSI would be affected, please reach out to us and we can walk someone through how to do that calculation. Next slide, please. This is what an SSI calculation looks like with earned income only. So for example, if someone were earning $885 a month, the first thing Social Security does is they say, okay, we're not going to count $20 of that. That's that general exclusion we talked about. That leaves $865. Then they're going to deduct $65 called that earned income exclusion, divide that by 2, and that means that instead of Social Security counting $885 of earnings, they're actually only counting $400 of earnings. So they're not going to do that dollar for dollar reduction from SSI. So then what we do is we look at $943 of the federal benefit rate. That's the max amount that someone can earn from receiving SSI for 2024. They're going to deduct $400, which is the countable earned income, and that means the new SSI payment would be $543. So you can see instead of doing the SSI dollar for dollar reduction, what they're doing is actually a calculation. So the new SSI plus the $885 of gross earnings means the total income would be $1,428. That's much better than just earning $943 from SSI. Next slide, please. So we're going to look at Benna's specific situation. Now with Benna, she's earning $2,000 a month of earned income. What we do then is we take the $20 off the general exclusion, which would be $1,980. Then the $65 of the earned income exclusion, we divide that by 2, and that means Benna's countable earned income is $957.50. So Social Security isn't looking at her earning $2,000, but $957.50. So again, that federal benefit rate for 2024 is $943. And when we subtract the $957.50, that means that Benna's SSI payment actually goes to zero. So her SSI payment, she wouldn't be getting that cash payment. But when you look at that plus the $12,000 or $2,000 of gross earnings, that means instead of her receiving $943, she actually has $2,000 total income. So that's the first roadblock that we're looking at. Next slide, please. So the second roadblock we're looking at is 1619B. So one of the issues that we run into a lot are that people are okay with their SSI cash benefit reducing or eliminating, but they really want to keep that Medicaid. And that's what 1619B allows. Next slide, please. So after reviewing the SSI calculation with Benna, she understands that she will have more money when working. Even though her SSI payment will be zero, Benna's total monthly gross income will be $2,000, which is much better than that $943 of the SSI. However, Benna is worried that she will lose Medicaid, which she needs to manage her disability. Next slide, please. So what we can possibly use is called 1619B, that work incentive we discussed. And that enables an SSI beneficiary to maintain eligibility for Medicaid if their SSI payment decreases to zero due to work earnings. So to qualify for 1619B, a beneficiary must have been eligible for an SSI payment for at least 1 month, still meet the disability requirements, still meet all non-disability requirements like the resource and the asset limit, need Medicaid benefits to continue working, and have gross earnings that are insufficient to replace SSI, Medicaid, and publicly funded attendant care savings. They also have to be under the federal yearly threshold, and in Iowa, the 1619B threshold for 2024 is $45,246. Now we know there are other states that are on this call or this webinar. So if you're from another state, you can look on your DHS website and you'll be able to find out what the income threshold is for Medicaid. Next slide, please. So the third roadblock is resource and asset limits, which we'll be discussing. Next slide, please. So what are resource limits? Well, resource limits are basically the amount that someone can have and still maintain what that Medicaid would be. So after reviewing her expenses and new monthly income, Benna realized they will likely be able to set aside money every month in a savings account. Benna has not had the opportunity to save more than $2,000 total since becoming eligible for SSI. However, Benna is worried what will happen to her SSI and Medicaid eligibility when she saves beyond $2,000. Next slide, please. So SSI resource and asset limits. So these are things that count as resources for Social Security. Cash, bank accounts, stocks, mutual funds, U.S. savings bonds, retirement accounts, life insurance, personal property, vehicle, land, real estate, deemed resources, anything else which could be liquidated into cash and used for shelter and basic living expenses. Next slide, please. Now, what doesn't count as asset limits? So what doesn't count as asset limits are the home that you live in and the land it's on, one vehicle if used by the household for transportation, household goods and personal effects, life insurance policies combined face value of $1,500 or less, burial plots or spaces for you and your immediate family, burial funds up to $1,500 each for you and your spouse's burial expenses, property you or your spouse use in a trade or business or on your job if you work for someone else, money, property saved into a plan for achieving self-support, that's that PASS that we talked about earlier, and up to $100,000 in achieving a better life experience and ABLE accounts established through the state ABLE program. And we're going to talk about what an ABLE account is. So what is an ABLE account? So we get questions a lot from individuals that want to know how they can save and still maintain their eligibility for Medicaid. Because when it comes to Medicaid, Medicaid is like a house and there's lots of doors to get into that house. And depending on the Medicaid plan that you're involved in, That's how you'd be able to know what your asset limit is. For example, the 1619B that we discussed earlier has an asset limit of $2,000. So how can someone save for more than that and still maintain their eligibility for asset or for Medicaid? And one example of how to do that is with an ABLE account. Excuse me. So an ABLE account is a tax advantage savings account for eligible individuals with disabilities. An ABLE account, basically the balance in an ABLE account is not counted towards any needs-based programs, which means it will not affect SSI, SNAP, or HUD housing, and you can use that to cover any qualified disability expense. And we're going to go over what a qualified disability expense is. Excuse me, one second. So contribution amounts, how much can someone save into an ABLE account? An individual who qualifies can actually contribute up to $18,000 per year in 2024. And if someone is working, they can actually increase that contribution by an FPL of 1, which would be up to $14,580 added to the $18,000 per year if someone were working and contribute that higher amount. To be eligible for an ABLE account, someone just has to be diagnosed with a disability before the age of 26, and one of the following is true. Eligible for SSI or SSDI due to the disability, experience blindness as determined by the Social Security Act, or have a similarly severe disability with a written diagnosis from a licensed physician that can be produced if requested, which is a very important thing to note there, because that means that someone does not have to be Social Security defined disabled to qualify, as long as they were have a disability diagnosis before the age of 26, that they could still qualify. Now, there is an ABLE Age Adjustment Act, which will be effective January of 2026, that increases the ABLE age eligibility from 26 to 46. And that enables an estimated 6 million more Americans, including 1 million veterans, to become eligible for ABLE. Next slide, please. So what are quality of life expenses for an ABLE account? It is a fairly long list: assistive technology, basic living expenses, education and training, financial management, health and wellness, housing, legal fees, transportation. Pretty much you can do a lot of things with that money. You maybe can't go out and buy a big screen TV. That would be considered an asset, but it is a fairly long list that can be used for quality of life expenses. Next question, or next slide, please, sorry. If you have any more questions about ABLE account or how to open an ABLE account, because it is relatively easy to open, it's much easier to start than a special needs trust, for example, then you can go to the ABLE National Resource Center. You can actually look up information by state. For Iowa residents, you get a tax incentive. Most states do offer a tax incentive, and it's oversaw by the Iowa Internal Revenue Service, or what your state's revenue service is, or your state's treasury office. So each state has a little bit different rules. It's easier to access the money than it is with a special needs trust, and you don't really need an attorney as far as setting up an ABLE account. So if this is something that you qualify for, someone you know would qualify for, or you would like extra information on it, please feel free to reach out to us and we can talk to you more in depth about ABLE accounts. Next slide, please. So our fourth roadblock we're going to discuss is SNAP. So what happens to Benna's SNAP? Next slide, please. So after providing information on ABLE accounts to Benna to help her maintain Medicaid eligibility, Benna reviews her monthly expenses and remembers she receives a $50 per month payment from SNAP. Benna wants to know if she will continue to receive SNAP and how now that she is working. So with SNAP, it is a state-run federal program that provides nutrition benefits to supplement the food budget of people who meet income and other eligibility requirements. SNAP counts income from all sources, including earned gross income and unearned income. Cash assistance, Social Security, unemployment, child support, that all counts. So that's typically one of the benefits that you will see a reduction in first. Due to how SNAP is calculated, individuals typically see their benefit amount decrease or terminate once they begin working. Next slide, please. The fifth roadblock is HUD housing. And I just want to point out with SNAP that the calculation is quite difficult. So it's hard for us to calculate what someone's SNAP would be when their income increases or decreases. So you typically will have to report your SNAP income, or not your SNAP income, but your work income to know what your SNAP will be. So now we're going to talk about the fifth roadblock, which is HUD housing assistance. So since Benna's SNAP benefit was $50 prior to starting work, Benna will likely no longer be eligible once she reports her earnings. She says she's okay with no longer receiving SNAP. However, she is concerned about her rent increasing. Benna only pays $250 per month because she receives housing assistance. You advise Benna to contact her case manager at the local public housing authority for help in determining what her new rent amount is. Like with SNAP, individuals won't know their new rent amount until they report their change in their income. Next slide, please. The sixth roadblock is the benefits cliff. And this is a very important thing to note because even though we're always promoting work and always hoping that work is beneficial for someone who's receiving benefits, unfortunately, that's not always the case. So we have to look at someone's benefits as a whole. So after helping Benna determine how her SSI and Medicaid and her resources and assets and SNAP and HUD will be affected, she's concerned that she will not be better off by working. So what the benefits cliff is when an individual earns too much to maintain eligibility for their public benefits, but does not earn enough to offset the loss of those benefits. They're in a worse financial situation because they're actually working. So it's important to examine a person's specific situation and offer accurate and timely information so they can make the most informed decision possible. And that is why it's very important to look at someone's entire benefits situation and offer the most, as we point out in this slide, the most timely information. Benefits planning is so important to make sure that everybody can make informed decisions about their own benefits. Next slide, please. And this is the potential situation for Benna. So you can see without working, she had no gross or net earnings. Her SSI payment was the maximum amount of $943. Her SNAP was $50. That means her total income was $993. She didn't pay anything for her Medicaid. Her transportation had no cost because she wasn't traveling to and from work. And her housing was $250. And that's just an example. So that means that her remaining money after she paid for her rent and other expenses was $743 that she had each month to live on. When we look at her work with earnings, with our example, it was $2,000, and we do all the calculations, she actually has $1,100 remaining money, which means that in Benna's situation, she's actually better off by working, and that's what we'd like to see. Plus, she gets to keep her Medicaid, so she's able to work even though she's no longer receiving an SSI payment because of that 1619B work incentive. She's able to continue working, maintain her Medicaid, and if she starts an ABLE account, allow her to save money in her account that she was not able to do while she was not working, even though you don't have to be working to have an ABLE account. In our situation with Benna, she's now able to save money. So in this specific situation, we're very happy to say that Benna is better off by working. Next slide, please. And I'm going to go ahead and turn it over to Misty, and she's going to talk to you about SSDI benefits.
Thanks, Tammy. So with this SSDI or Title II scenario, we're going to meet Matt. Matt is a 56-year-old Adele resident who became disabled after 25 years of working at a local agricultural manufacturer. His wife, Sarah, works part-time as a local retailer, and her work schedule allows her to manage the caregiving duties for their 2 children. Matt recently was approved for SSDI based on his work history, but his Medicare benefits aren't going to start until he has received 24 months worth of checks from SSDI. He's paying $800 a month currently for his family's health insurance through Cobra, and Matt's looking for work that will supplement his family's income and help out just the bottom line of their budget every single month. Next slide. So our first roadblock is starting off right away, understanding some of the work incentives that come along with that SSDI or Title II benefit. Next slide. So this potential roadblock, we want to talk a little bit about the trial work period. With Matt, his SSDI payment is $2,200 a month. He was offered a part-time job working 25 hours per week at $18 an hour, and that equals up to about $1,948.50 gross earnings in a month. Matt wants to try working at this job, but he's really concerned and really can't lose that SSDI payment right away. So he kind of debates turning down this job until he is able to talk with a benefits planner. Next slide. So some of the work incentives that would apply to Matt's situation is the Title II or SSDI work incentives. There's kind of phases that a person would go through as they look at work and how that might impact those disability benefits. Some of those you'll see highlighted here on the slide that we are going to talk about is the trial work period, extended period of eligibility, many others, along with the expedited reinstatement. And some of these work incentives that are listed on the slide apply also to if somebody's working self-employment. So we want to make sure and touch on some of these for you today. Next slide. With the work incentive list that I just showed you, we've kind of used the analogy of a road trip, right? Because as those phases that I mentioned, the first part of those phases is the trial work period. So a person would have 9 months where they could work and earn as much money as they'd like before it starts to impact those benefits at all. So in this case, in 2024, if somebody works and they're under the amount that's trial work period for this year, which is $1,110, next year is $1,160 in gross earnings a month, they wouldn't even use up a trial work month. If they hit that amount, then they would take off one of those trial work months. And a couple of really nice things about the trial work period is that with those 9 months that Social Security says you have, you don't have to use those up consecutively. So if somebody went to work this month and didn't hit that $1,110 peak of the trial work month's amount, they wouldn't use a trial work month and they'd have 9 to go. So let's say next month they did and they made $2,000. That would be a trial work month. So you could use those up consecutively or not, depending on your situation. And again, that amount of earnings does not jeopardize the cash benefit or Medicare when somebody has the trial work period. Typically, as I mentioned in the first couple of slides, when somebody gets SSDI or Title II benefits initially, they may not even have Medicare until the 24-month mark. And again, just to mention, somebody can still have trial work periods available to them if they do self-employment. Same kind of thing applies as far as earnings, the 1110 for 2024 and 1160 for 2025. Or it could be a combination of those things with 80 hours plus a month of work of those substantial work services or work activity. Next slide. So that could be a potential roadblock, the trial work period. Since Matt hasn't worked since he started receiving his benefits, he has all of these 9 trial work months available. He can accept the job and test out work without losing that monthly payment. If, in fact, he had worked previously since he was approved for benefits, then we'd need to take a little deeper dive into that to determine whether or not Matt had used up any of these trial work months. And if he still had several available or not, that's something we would look into. And that goes back to what Jenny had mentioned early on in the presentation. Reviewing those benefits planning queries or BPQYs is so important to kind of cross-check, if you will, what the person is telling us versus what Social Security has on their record. And some of those things only are adjudicated into the record when there's a work review performed. And some of those work reviews can take several months to complete on Social Security's end of things. So we don't want to always depend on just what that snapshot in time looks like. And there's other internal factors that the local Social Security offices would have come into play when they're doing these work reviews. So we have to do a little investigating on that piece. Next slide. So our second roadblock that Matt could face would be understanding substantial gainful activity, or SGA. Next slide. So this potential roadblock, SGA, that substantial gainful activity, is really the amount that somebody can work up to and still maintain their benefits. And in Matt's case, while he's super excited about the opportunity to accept the job offer and contribute additional income to his household, he's worried that this will happen, once one of those trial work months are gone, then what? So will Matt be able to continue receiving SSDI, and what will happen with his monthly payment? This happens to a lot of people. They get very concerned about what that's going to look like and whether or not their earnings will match up with what Social Security has for the SGA for that year. Next slide. So a little bit of a description on what SGA, or substantial gainful activity, is. It's the individual is performing significant mental or physical duties for profit. And again, this is Social Security's this description. Or that person demonstrates the ability to work despite a disabling condition. This year, for 2024, when this presentation is being presented, that number is $1,550 for non-blind individuals. For blind individuals, that's $2,590, both gross monthly earnings. Next year, we're looking at a non-blind amount of $1,620 and then a blind amount of $2,700. So that means that somebody can earn up to this amount and still maintain their SSDI, or Title II benefit. Next slide. Just one thing I wanted to mention, that SGA just isn't about that number. Although somebody might call us and ask us, hey, how much can I make this year? We really want to explain to them that that is not just about that amount. It's an objective, a concrete dollar figure that Social Security does set, but it's more than that. They have to determine whether or not there are other rules or maybe work incentives that might apply to that person, and really use their best judgment to render that decision about the value of individuals' work. And sometimes that comes into play when we're talking about work incentives like a subsidy or an IRWI, like Tammy had mentioned earlier. And SGA determinations involve those interpretations of complex regulations as they apply to an individual beneficiary, giving on every single piece of that person's unique situation. Next slide. So part of that with the SGA, if somebody is working over that amount during the trial work period, that's okay. You can earn as much money as you want during those 9 months, like I mentioned. However, once those 9 months are done, you go into the second phase of that road trip, and you'll see on the graphic that there's 36 brown stepping stones on this dock, or dock boards. And that means that extended period of eligibility, or phase 2, is another period of time where an individual can work and maintain benefits. But if they do go over that amount for the substantial gainful activity amount during this window of time, what happens is their check will pause. Doesn't mean that they're not eligible for benefits or that they are no longer disabled. It just means their cash benefit, if above SGA, will pause. If it's under SGA, they keep getting their benefits per usual. But if those pieces are at play there, then they would pause their check. Some people could go off and on their cash benefits throughout this whole 3-year period of time. And as the slide mentions, there also is a spot, if they see a pattern, Social Security, that somebody is going over SGA, they would get a cessation month and 2 grace period months to still be able to keep their benefits without owing those back to Social Security. Next slide. So the potential roadblock for Matt in this case would be that once Matt has used up all of his trial work months, he will enter that EPE stage. Social Security will review Matt's earnings to determine if he still owed a monthly payment. Like I mentioned, it could pause. Based on Matt's projected monthly earnings of $1948.50, he'll be over that SGA amount if he can't use any other work incentives. So following that cessation and grace period months that I mentioned, Matt won't be eligible for his SSDI payment in the months that he's earning over SGA. Next slide. So our third roadblock, we wanted to mention auxiliary benefits. If you remember in this scenario, we mentioned there's kids in the scenario as well. Next slide. So part of that is during the decision on the SSDI work incentives, Matt shares he's just received a letter from Social Security that's stating his 2 children will receive auxiliary benefits off of his record. And Matt wants to know how working impacts those children's payments along with his own. So auxiliary benefits are paid if that Title II or SSDI beneficiary whose work record they're based on receives their monthly payment. If that DI payment stops, then the auxiliary payments also stop. So in that EPE time, if there's pauses, those auxiliary benefits would pause as well. Next slide. So here's the potential situation for Matt. We talk about what it will look like without Matt working. So he receives that SSDI payment of $2,200. His wife works at $2,000, plus his auxiliary benefits for his kids are at about $1,100, which brings that gross monthly earnings into the household of about $5,300. If Matt goes to work, and these are earnings before the SSDI pauses, now keep in mind this is during the trial work period and some of those months in the EPE perhaps, that he would still have wages from work in this scenario, the $1948.50. His wife is still working at $2,000. His DI payments then, while they're still going, are $2,200, and his auxiliary benefits keep going as well. So you see during the trial work months, they're going to have a lot more earning potential coming into the house in those gross earnings. However, if Matt keeps working and after the SSDI pauses, that means his income is $1948.50. His wife's income is $2,000. However, you'll see the SSDI payment will stop as well as the auxiliary benefits will stop. So you're going to see that total earnings coming into the house is now less at $3948.50 than it was before Matt started working at all. So again, before factoring on all those differences with expenses, the household would have $2,500 less for income with the loss of both SSDI and the auxiliary benefits. And keep in mind a little side note, auxiliary benefits go through your children up to age 18. Next slide. So let's look at that a little with a different lens. If Matt has gross earnings, but he decides that, excuse me, he wants to work less than SGA, substantial gainful activity, which I mentioned this year is $1,550. So if he works at the $1,500 level, his wife's income still comes in. He still receives an SSDI payment and receives those auxiliary payments. And you can see on the slide how the differences are, whether or not during the trial work period months where he still keeps those benefits going, and then with Matt's earnings during EPE and he's working a part-time job. You can see how the difference is and what has some definitely big impacts as he's looking at those things. And before factoring in those expenses, you can see the household would have $1,500 more with Matt working under SGA after those trial work months are over. Next slide. So we have a fourth roadblock. What about health insurance? As I mentioned at the beginning of the scenario, when he starts looking for work, Matt's paying for COBRA, $800 a month. Next slide. So let's talk about that a little bit. During that decision on those SSDI benefits, Matt tells us that he has that $800 a month expense for the COBRA to maintain that family health insurance. And he's in that wait time for Medicare. Matt wants to apply for Medicaid for himself while he waits for Medicare and his family. However, he's heard that he and his family might not be eligible due to their income and assets. What are some of those options for Matt to find a more affordable health insurance? Let's take a look. Next slide. So a few of those things with Iowa Health and Wellness Plan provides comprehensive health coverage at low or no cost to members. However, the eligibility is based on household income. So to be eligible for the Iowa Health and Wellness Plan, you'd have to be an adult between 19 and 64. You'd have to have an income level that doesn't exceed 133% of that FPL. So that kind of breaks it down there. And really, you'd have to not be otherwise eligible for Medicaid or Medicare. Do we think that he's eligible for the Iowa Health and Wellness? Probably not. Next slide. So let's look at another option. So if Matt is working and he has the disability benefits or that diagnosis with disability, there could be a potential for Medicaid for employed people with disabilities, or MEPD. This would be considered Iowa's Medicaid buy-in. If you're in a different state and watching this presentation, go on your DHS website and look for your state's buy-in. If they have that available, it could be called something else, but that's one way you could find it in your state. And what it is a coverage group that allows people with disabilities to work and continue to have access to medical assistance. But what's really great about it is in Iowa, if you are earning under 250% for a family of 4, that's $6,500 per month. And that could really break down into coverage for you if you meet other criteria. As I mentioned, you have to be under age 65, you have to be working and still be considered disabled under the SSI or medical criteria for disability. And then the resource and assets are a lot higher than it is for regular SSI or Iowa Health and Wellness Medicaid. So that is $12,000 for an individual or $13,000 for a couple. Next slide. And using that calculation, the household's countable income would be about $5,200 and some change. If Matt accepts that job offer for $1948.50 per month, he would be eligible for MEPD. However, Matt and Sarah have $18,000 saved in a bank account. Is he still eligible for MEPD? No, because there's $13,000 is the asset limit for a couple. Next slide. However, when he learns that he wouldn't be eligible for the Iowa Health and Wellness, he also learns that he's not eligible for MEPD due to that money they have saved. So besides his health needs, Matt's concerned about he and Sarah having kids' health coverage. What are some of those other options for affordable health care for insurance for kids? Next slide. One of those is Hawkeye, the Children's Health Insurance Program, or SHIP. CHIP is a joint federal and state program that provides health coverage to uninsured children. This is offered under the Health and Wellness for Kids, or the Hawkeye program. And you can see the breakdown there of the family of 4. It's free if your earnings are less than $52,104, up to $56,783 for 2024. So are Matt and Sarah's children eligible for Hawkeye? Next slide. Although Matt and Sarah could enroll their children in Hawkeye for health coverage and pay that $10 or $12 per child every month, if Matt works and the couple's savings decreases below that $13,000, then Matt would have that option for MEPD. And I'll side note on that is that if the age part of it is applicable for the ABLE account, that might work as well down the road. Matt and Sarah can explore the health insurance marketplace for coverage if they don't want to spend down their savings while Matt waits for that Medicare to kick in. And just a side note is if Matt obtains coverage through MEPD, Sarah's likely only option would be a coverage through a marketplace plan. So there's a lot of moving pieces when you talk about health insurance and how that impacts a family in general. Next slide. So navigating that benefits cliff, as you can see, Social Security disability beneficiaries can work and obtain greater financial independence. However, the rules and regulations within that can lead to overpayments, loss of health insurance, and a lot of confusion. That's where Social Security disability beneficiaries can go to help returning to work and understand their benefits. Next slide. They can connect with the Ticket to Work helpline. And what is Ticket to Work? It's a place where, excuse me, where beneficiaries can check out the Ticket to Work helpline or give them a call, and they can provide choice in obtaining services, whether that's support of just employment services in general, benefits planning, all of those things can be made of a connection under the Ticket to Work program. And again, you don't have to assign your ticket to any employment network specifically. It's free and voluntary, and it makes those pieces really come together when you can have someone connecting you. Next slide.
So that is just a really brief overview of two different situations that we see all the time with individuals across the state of Iowa. And if you're outside of the state of Iowa, is probably very familiar in your state as well. So if you're wondering, especially how do you connect individuals with a WIPA program, whether you're in the state of Iowa or across the country, the very first step is to encourage eligible beneficiaries or someone who might be wondering, would I be eligible for this support, to contact the Ticket to Work helpline. And that is available Monday through Friday from 8 to 8 during the day, 8 a.m., 8 p.m. Eastern time. And we provide both the number for voice and then also TTY as well. Now, the really nice thing about the helpline is they're that very first step into determining eligibility for WIPA services. So they can talk with a beneficiary about their situation. They can just do a quick verification that they're getting a Social Security disability benefit and determine, yes, that person would be a good candidate for WIPA. They'll then assign the beneficiary to that correct WIPA project. For example, if someone's in Illinois, they'll get assigned one of the three that covers that state. So they'll make sure to get it to the right one based on that person's residence. And then us as a WIPA project, we will get an email, it's a secure email, with a referral with that beneficiary's information. I like to say when I'm working with beneficiaries, I just get a little brief snapshot about their situation. They'll mention, are they working? Do they have a job offer? Maybe, they're still, they've started work, but they're wondering, how do I report that income? I've already made that jump to working, but now what do I do? Because they want to make sure that they're doing everything right. And our goal is to help someone avoid those pitfalls. We didn't even talk about overpayments, and we'll actually might have some time to be able to highlight what some of those pitfalls with overpayments are. But us as a WIPL project, we're required to contact that beneficiary within 5 business days of getting that referral. And we try up to 3 times, or a total of 3 times, to reach out to them. We'll do phone, we'll do email, and we often also send letters if we can't reach someone, knowing that if someone's working, we try and be very flexible with time. We'll meet with people in the evenings and then occasionally on the weekend, just because if someone's full-time, they're probably not going to be available a lot of the week when we're also calling or trying to reach out. So what happens when someone gets connected with us? Like I said, we have 3 chances where we try and reach out to them. If we don't connect with someone, we'll send them a letter. We'll shoot them an email saying, hey, we're trying to reach you. You might remember you were talking to the Ticket to Work helpline and someone was going to be talking about benefits planning. So if we get connected with someone, whether on an initial try or after reaching out via email or a letter, we'll talk with the beneficiary about their situation and to determine what sort of support do they need. Now, a beneficiary might just need some additional information of what will happen if, like Misty said, if they're a Title II beneficiary and they're earning, let's say, $500 in a month, they're not starting that road trip yet. I like to say they're still at Quick Star debating, should I get some Dots pretzels? Should I get a different snack? They haven't left on that road trip yet. Now, if we're working with a beneficiary and let's say they're like in Matt's situation where they are earning close to $2,000 and eventually are going to hit some of those road bumps, we want to offer and make sure that they know that we can provide more of that in-depth support. So if a beneficiary is interested in WIPA services, we'll send them some releases. I like to say we are not Social Security, so we're not sending them a novel, just some releases so we can get that BPQI and then also verify any other benefits that someone receives. So they could have Social Security disability benefits, but they also will likely have Medicare or Medicaid, SNAP, housing, veterans benefits. Every so often I don't actually understand how I get this benefit, but I get a check every month and we have to put on our investigative hat and figure out what's actually going on because every single benefit is going to be different and have different stipulations. So we as the CWIC are going to verify so we can understand what is someone's benefits. It could also be their children's benefits. We didn't go into, and we might be able to highlight, we didn't go into if someone gets an SSI benefit, what if their kid's getting an SSI benefit? You know, what are those other ones that unless we're asking those questions, we could easily miss? So us as a CWIC, we get all of that information. We try and get that full, complete picture of someone's situation. And we will meet with the beneficiary and any other members of their employment support team to discuss next steps. If we're working with a beneficiary, it may be helping educate their family or an employment specialist on what that beneficiary's situation is. Because the more ears that can hear that, the more information that can get shared, the best that person has to be able to make sure they're hitting all those benchmarks. We as a CWIC will write up what's called a Benefits Summary and Analysis, or BS&A. Once again, not a novel, but just a brief outline of what are that beneficiary's employment goal and how is it going to impact their benefits. So sort of like we did today with the different roadblocks, we'll outline this is someone's benefits, and when they're working at this level, maybe this person's like Matt, going to use their trial work period, going to hit EPE and eventually have it pause. Or maybe things are going to keep going, they're going to keep trucking down the road and nothing will change. But that way, that beneficiary, whether it's their Social Security benefit, health insurance, or any other the benefits they receive, they have that handy to know, yep, Jenny, Misty, and Tammy told me something, I know it's here. We also tell them, hey, if something changes, let's say you get a promotion from work, let's say you decide to switch jobs and now you're earning a different amount, we can update this. This isn't set in stone because we know someone's employment goals can change. Once we write up that BS&A, us as the CWIC, the beneficiary, and anyone else as part of their support team will meet to review that report together, once again, so everyone understands what will be happening with someone's benefits. It could be that the beneficiary says, you know, I'm fine with eventually working off benefits, but when is that going to happen? When will I see that SSDI check stop? When will I see my Medicaid stop? So they can then prepare and feel confident and make that educated decision that works for them and their families. We'll also develop a follow-up plan for future critical touch points. So for example, in Matt's situation, we'll write up, you know, for these 9 months in that trial work period, nothing's going to change. But then once we hit what we estimate will be the 9th month, we'll follow back up and say, hey, is everything going the same? Are you still working at this level? Has anything changed? It could be that Matt was like, you know what? I actually stopped working a couple months ago due to changes in my health. And we're like, yep, that's totally fine. This is now what your future is going to look like, at least on that roadmap. We like to hit up those follow-up touch points so we can make sure that beneficiary feels supported at each step. Maybe we also will reach out if Matt decides, you know, I eventually do want to work off of benefits. When is that check going to pause? We can follow up with him a month or so before so he knows, yep, this is what's going to happen. This is about that timetable. so he can feel prepared when he receives letters from Social Security or any other entity that he's receiving benefits from. Will know, yep, I anticipated this. I know I should be getting a work review letter about this time. I know that I'm not going to be eligible for this benefit after this time. So it's no longer a surprise, but they can plan for it. And like with a BSNA, we can adjust that follow-up plan based on someone's situation. So if Matt, we contacted him and he was like, I only actually worked 5 months, we can update that follow-up plan if Matt says, I'm thinking about pursuing employment again in about a couple months to see how my health goes. We can set a time to be able to reach out and say, hey, how are things going? Are you still looking at work? Do you want us to update that report for you? So once again, they can feel supported. I know Tammy and Misty would definitely say they have clients that they've worked with for 10 years or more, that at different points their employment goals change. Maybe they just wanted to test out work initially, and now they've gotten to a point of maybe they want to start their own business. Maybe they want to work full time. And so they know who can they go to. Even if we don't have an answer for them, we're very good investigators and we'll try and find either the answer or someone that's going to be able to provide that more direct support. And it all is a key piece of part of that follow-up services. So we did get some messages in the chat asking about resources because we could have made this presentation go all day, but we know at least stop for lunch, right? A couple additional resources that you'll get when you'll get this PowerPoint slide is we have a link to your local Social Security office locator. Oftentimes we speak with beneficiaries that say, I don't know what my local office is. I don't know who I should be contacting. That locator will take you to a link where you can put in someone's zip code and it'll pop out what is their local Social Security office. We also provide a link to the Ticket to Work website. If someone is wanting support with finding a job, maintaining a job, there is a link to be able to search for support. If someone wants a local resource, a local agency, they can specify a certain distance out from a zip code. It also can be that they're looking for virtual options. So someone can look through and see what services they want and what agencies are providing that. We do provide a link for the annual Social Security Red Book on employment supports. So if you heard this presentation and you are ready to do a deep dive, this is the book for you. This provides a lot more information on these various work incentives. Like I said, we provided a very overview, knowing that every situation can get very complex and different very quickly. So this is just a great general overview directly from Social Security. We also are providing links for the Disability Rights Iowa website. It has not only a page on us, but a lot of the other resources that we can provide across the state of Iowa. So if you want to learn more about Disability Rights Iowa and what we might be able to offer for you or clients that you're working with, please go to our website. We also offer a link to our YouTube channel. If you would like to learn more about some of these different work incentives, you will be seeing one of our team members presenting various brief videos to learn more about things like IRWIs and PASS to better support beneficiaries. We do include a link to our Iowa and Northwest Illinois Facebook page. We do not post every single day, but we try and really highlight when we have an upcoming presentation or event, or just some good reminders, especially like how the 2025 numbers to know the trial work period amount, SGA recently came out. We try and highlight that. We do include a link for UpLift, the Central Iowa Basic Income Pilot website. So if you are just now learning about UpLift and you want to know more, that is your go-to site to be able to look and see what events are coming up and what other information that you can gather about the pilot. And finally, we also include a link to the community conversation series. If this is the first time that you are joining this conversation and you want to know more, please check out that page. They also just recently had one on housing. And so if you'd like to know a little bit more on housing and some of the issues facing, especially Central Iowa, but would be applicable to a lot of places as well, please go to that link. And lastly, we want you to walk away from this presentation remembering that Social Security disability beneficiaries can work and receive benefits. There's unfortunately a lot of misinformation and a lot of fear from people that we work with. I, no joke, have worked with someone who, when they got connected to me, thought they were going to be going to jail because they worked and received a benefit. And that was because someone that they lived with or close to said, hey, you can't actually do that. And so just getting to the point where someone's even looking at work is a big deal. And so please walk away from this. If you are working with a client that has a disability benefit from Social Security, work can be an option for them, but they want to connect with a benefits planner to understand their situation. Minor changes in Benna's and Matt's situations could really change the outcome. And so we want to make sure those individuals are getting connected with people that can explain this in greater detail or highlight other work incentives that they might be available to use. So currently, our team of WIPA 3, Misty, Jenny, and Tammy are here to help. We are available to answer questions. I do want to highlight before I take the slide down to take some questions. We have the Ticket to Work helpline number again. We also have the general line for Disability Rights Iowa. So if you have questions, want to get a hold of us, please feel free. And as a reminder, we are part of the WIPA program. And I'm going to turn it over to Michael just to provide some additional information at the very end of our presentation as well. But what questions have we not got to that you're dying to know? So let me look in the chat. We have just a couple also that we've gotten through. Tammy, I have a question. What issues could have caused Benna to go over the benefits cliff? I know you mentioned that she was able to avoid it this time around, but are there things that might have come up in her situation that would have made it look a little bit more Matt's of, things might not be working? I know we had mentioned transportation, but what are some things that might have caused her to hit that cliff?
Yeah, and certainly we can talk about that. Obviously, looking at all-encompassing benefits, like how much is her transportation cost? What is her rent going up to? Is the SNAP going to be an issue for her? Like, we have to look at everything as a whole to determine if they're going to go over that benefits cliff. Luckily, in our example that we have with Benna, she would be better off by working. But when it comes to needs-based programs, unfortunately, they're set up so it's like a cycle. It's like a circle that sometimes they just can't escape from. And knowing how those benefits are affected are super important to making sure that everybody can make an informed decision about their benefits. So depending on if she couldn't have kept her Medicaid, for example, Medicaid is like a house, and there's different doors to get into that house. And we need to figure out, which Medicaid program would be the best fit for her. And for us, that would be the 1619B because she was receiving SSI. Her cash benefit went to 0, and she met all of the resource and income limits for 1619B. But if that wouldn't have been the case, we could have looked at other options. There's several Medicaid benefits or eligibility groups, I should say, that can qualify someone for Medicaid. Like Misty talked about, there's Iowa Health and Wellness. Iowa Health and Wellness is income-based, not necessarily disability-based, but it doesn't play well with other benefits, health insurance benefits. So for example, someone couldn't have Iowa Health and Wellness and still maintain Medicare or a company healthcare policy because it's its own entity. But if somebody had 1619B, or if somebody had Medicaid for employed people with disabilities, then they could potentially have other health insurance options, like if they qualified for Medicare or if they qualified for a company healthcare policy. So that is such a loaded question to ask, what things could have put her over the benefits cliff. Several things could do that. And that's why each case requires an individual look and an all-encompassing kind of scenario where we're saying, okay, what can we expect to happen and how can we help this beneficiary achieve their goals?
I think I would really quick just add on to that. Something as simple as another $100 could make all of that stuff shift into a whole different scenario. And I think that's really important with the benefits cliff just in general, is that people understand it's not thousands of dollars that we're talking about that can make somebody not want to go to work, as in the scenarios we talked about today. It can literally be $100 or $200 that can make that decision be a total different outcome than what originally was talked about. So a lot of moving parts can happen.
I would completely agree with that. And I'd, ask you to look up the information on the UpLift program regarding that, where individuals can receive that $500 cash payment, and look how it has affected people's lives. You know, like Misty said, even small amounts can make a big difference when it comes to a person's situation.
One thing I'll add that we haven't highlighted if there was someone who was receiving a disability benefit, we actually helped provide counseling for individuals who were approved for UpLift to talk about how is this going to impact them. And for some people, it was still going to be a benefit, but there were individuals that were actually going to see a negative financial situation, even though $500 doesn't seem like a lot. Depending on someone's benefits and their situation, it could be honestly not as beneficial. And so that's why we're talking, like they said, narrow, thin margins, depending on someone's situation. We do have a question about or highlighting someone's especially intrigued by ABLE accounts. We love that. We love ABLE accounts, and how they could connect to the asset test for SNAP that's set to be implemented in Iowa in mid-2025. So Tammy, your favorite ABLE accounts, want to highlight more of how that can really help someone's resource and asset limit issue.
Yeah, ABLE accounts are really, really good ways for someone to be able to save and not have to worry about those pesky asset limits when it comes to needs-based programs. Before ABLE accounts, someone was not allowed to save, or families weren't allowed to give money to someone with receiving needs-based programs, specifically Medicaid and SSI, because it would kick them off their benefits. And if they're tied to waiver services, holy cow, that's like a golden ticket. You definitely don't want to miss any opportunity to keep waiver if you can. So working with an ABLE account just is a way that someone can easily get a savings account that's not counted towards those needs-based programs. And really that's how it works best, is as a savings account. If someone were to use it as a spending account, so for example, if someone were using it so they could draw money out for those quality of life expenses, just be very cautious that you need to keep receipts, because at some point, Social Security may ask, hey, can you show us what you drew out this $1,000 for? And if you don't have the receipts, then it's considered an asset. So even though the list is vast for quality of life expenses, you still have to keep track of what you're doing. But the ABLE account, someone can actually save up to $100,000 and still maintain their SSI benefit, and can actually still qualify for SSI or Medicaid up to $400,000. So it's a great way for someone to be able to save money, and use it when needed, or for family members to be able to save money for their family members that are receiving SSI or Medicaid programs. Now, keep in mind with an ABLE account that they'll still do the income calculations for SSI. So if someone's working, they're still going to have the reduction on their SSI benefit. It doesn't save them from, having any issues there. And someone will also, still have to adhere to the trial work period level and SJA level when it comes to SSDI. But it just makes it so that they can save money safely without impacting their disability benefits. It's easy to set up. Someone can just go on the website, get information. The Iowa ABLE account website is super friendly and easy to use. And someone can put a signatory on there so that someone else can help them keep track. Just remember that in order to take that money out, someone will actually get a debit card that they can use at like Walmart or Target or wherever else they go shopping. And if they're using it as a spending account, again, I can't stress that enough, keep receipts so that you are protected if needed.
Misty, this one's going to you. I think you're going to be very excited. One of the work incentives that was briefly mentioned was PASS. What is PASS? How does that work? And how would that have impacted either situation?
This is one of my favorite work incentives. I'll admit it. I'll admit it. A PASS, or a plan for achieving self-support, is a way to also set aside money similarly to the ABLE account. However, it's a little more strict and a little more focused. So if somebody is receiving disability benefits, and keep in mind, it can work in some cases for somebody with SSDI benefits as well, but mostly SSI benefits. It's a way for them to set aside money into a specific designated account that can help them save toward a vocational goal. For example, if somebody needed a vehicle that would allow them to not have to depend on transit or family members or friends to be able to get back and forth to their job, or maybe even increase their earning capability at that job, we might be able to set aside money into a PASS that will enable them to save toward being able to purchase that vehicle. There's a lot more examples. It's kind of a non-inclusive, I guess I should, or short list is that you could do it for a wide variety of things. And we can do it as early as age 14. As soon as that student is working, we could set aside money into a PASS. What's really great about it is when that money is in the PASS plan, it doesn't count against any of those needs-based programs, similarly to the ABLE account. So if somebody has SNAP benefits, HUD, Medicaid, any of those things, the money that's in this account does not count against assets or resource limits for those programs. And what's really nice is that, as an example, we'll say is that if there is something reducing that SSI benefit, so if they have a part-time job, for example, we could set that a money that's accountable, like you remember in Tammy's scenario in that earnings exclusion calculation, we could set that amount of money inside, and then Social Security doesn't have anything to count. So that person would be able to get a full SSI check, which would enable them to still have the same amount in their budget every month while still being able to save toward that vocational goal. It is a super impactful work incentive that's very underutilized. Although I will say Iowa has one of the highest rates in the country for PASS plans, which is super exciting to our WIPA team. But it's also very, very impactful for folks who receive SSDI as well. I will say a couple of caveats on that is the expense that you're saving for has to be feasible, right? As an example, if somebody's doing startup for a business, you can use a PASS to save for capital for that business. But we have to do a whole business plan, a whole application, and make sure that that is a feasible thing that we're targeting to do. Same with, your budget. We want to sit down and go through your budget as a beneficiary to know that this PASS plan isn't going to be detrimental to your budget. We want it to be a plus for you. So it all has to be feasible. And again, the whole point of a PASS plan is to be able to save that money for a vocational goal that it's going to reduce or remove that dependency on the disability benefits itself. So that's a very short, condensed version of what a PASS plan is. They're very exciting. I see a question just popped up in the chat regarding that. Yes, for Medicaid, a vehicle can be counted as an asset, but as Tammy mentioned early on, Medicaid in Iowa allows you to have a house or the property it lives on and a vehicle. If you have 6 vehicles, then we got a whole nother conversation going on. But you can have your own vehicle underneath that asset and resource limit when they buy it with a PASS. It wouldn't count anything against it during the PASS at all. I hope that answered your question.
Tammy, you love talking about Medicaid. So a question that's come through, how are Medicaid waivers impacted by work? And what if Benna had had a waiver?
Medicaid waivers are one of the most important things we try to protect, especially in Iowa. The ID waiver, the BI waiver, HAB services. All these waivers offer different services, usually to help someone live independently in the community and their supports that they need in order to work. So if Benna had had waiver, we would have looked at her earnings and the potential for any issues to keep waiver. Now, fortunately, in Iowa, what we try to do is figure out if we can keep Medicaid, then usually someone can keep waiver. Now, HAB is different, of course. HAB has the 150% federal poverty level for their family size. So when it comes to HAB services, unfortunately, that's not one of those things that we can usually get around if their income is too high. But on the good part of that, HAB really doesn't have a wait. So if somebody needs to let go of their HAB, that's not that big of a deal, and then they can re-enroll in it if they need it. ID waiver, brain injury waiver, and the other waivers, unfortunately, have a fairly long wait list. So if we're looking at someone's situation where they have one of those waivers that have a long wait, we're going to try and keep them tied to Medicaid. And if we can keep them tied to Medicaid, typically we can keep them tied to waiver. So my first thing would have been to look at Benna's situation and say, okay, what Medicaid options do we have? And are these Medicaid programs able to help her maintain her waiver service? And like I had said earlier about Medicaid, there's lots of different Medicaid eligibility groups. Each of them has their own asset level. Each of them has their own income level. Each of them has their own rules. So once they get in through that door, that's their Medicaid, but how do they have to meet the expectations for that Medicaid program? And we're going to try and inform them of what they can do or help them switch to a Medicaid program that would allow them to keep their waiver services.
Thank you. This, either Missy or Tammy, whoever wants to duke it out, if someone's working, what are their requirements for reporting those earnings to, whether it's Social Security or any of their other entities that they're getting benefits from?
I can take this if you want. So
Go
there's
for
a lot of options when you're talking about reporting earnings to Social Security. And I will say that we hear still, after doing this for a long time, that people don't know that they're supposed to report earnings. And it gets kind of cloudy because there are offices in both of the states that we cover that somebody who walks in the door or calls might get a gatekeeper who doesn't know the rules on reporting or the variances between the two programs. And my advice to them is report anyway, no matter what they tell you, because it's going to be better for that person to have a correct and current updated record. One of those ways for somebody who receives SSI is there is an app on your mobile phone that you could utilize to report earnings. There's also online version of reporting. If you have a My SSA account, which is housed within SSA.gov's website, you can create an account as a beneficiary and report your earnings there as well, both for SSI and SSDI. The caveat to that is Social Security has to have an initial call in your local office to let them know that you started work and who you're working for, how much you're making, those kinds of things. And then they're also going to ask for that employer identification number, EIN. A lot of times beneficiaries don't have an idea of what that is. And you may have to encourage them, if you're a service provider on the call today, to connect with their employer's HR to get that. Sometimes it's even listed on the pay stub. But Social Security will need that EIN to be able to start that online reporting version. People can still go old school. They can mail in copies to their local Social Security office or fax them in. Yes, I know they still have fax, which is kind of mind-blowing, but they can do that. One suggestion I would make, if they do a hard copy like that, and also on the faxes, is to make sure their name and Social Security number are included on every single sheet that gets sent in. That way, if it happens to drop off someone's desk, they can still connect the dots to who it belongs to. And in that vein, there's with the app, you can do it also with SSDI. It's a newer option or format to report, but I would just really say that at the end of each month, by the 6th or the 10th of the month for either of the programs, to get those monthly reporting earnings into your local office, whether it's however of the format. And a lot of office also will, especially for SSDI beneficiaries, will say if they're earning under that trial work amount, which again for this year is 1110, next year 1160. If people are earning under that, they may see offices telling them not to report at all. So just be wary of that we recommend they report anyway, because that's going to keep their record current and up to date, hopefully, with my fingers crossed. So that is an easier transition for if there's ever a work review or anything like that. I hope that answered your question.
I do want to highlight, so our project has 2 main brochures, and we can share that when we send out the PowerPoint. One is a dark teal, just general WIPA brochure. So if you would like any actual paper copies, we have tons of extras that we are more than willing to, if you work with a lot of different beneficiaries. But it provides some of that general information that we've shared today of who can we work with, how to get connected with us, and just that overall process of working with WIPA. What made me think of it is we actually created, and this is a light blue brochure that's specifically on wage and resource reporting. If you have ever tried to find a good one-stop guide from Social Security on wage and resource reporting, it's not really there, unfortunately. They do have a variety of different resources, but not something just an easy grab and go. And this highlights, based on what program you have, what types of things you should be reporting to Social Security, especially if you have SSI and that has that asset and resource limit, some things that you'll want to make sure they know. So we'll include the electronic versions, but please let us know if you would like to have any paper copies. We would be happy to send those to you. One question that came through is, I've worked with someone who got a letter about an overpayment. Do you, as a WIPA project, do you help with overpayments? What sort of support is available for them?
I can take this one. So when it comes to overpayments, what we try to do first is see if we can utilize a work incentive. So we will look and see, can we use an impairment related work expense, or can we use a subsidy, or can we use something to make it so that we're reducing those countable earnings either below SGA, or to make it so that their SSI isn't being reduced. And if so, then a lot of times we can reverse that overpayment just by simply using a work incentive. If we can't utilize a work incentive and it requires a waiver or a reconsideration or an appeal, then luckily at Disability Rights Iowa, we do have attorneys and advocates that can potentially look at this under our protection and advocacy services to see if there's anything that they can do to assist. If it's an appeal, there's a time limit on that where someone can appeal the decision. When it comes to an overpayment, if we can't reverse it with a work incentive, there's really only 3 things you can do. You can appeal it, where you're basically saying, hey, I don't agree with this at all, and I'd like to have Social Security take another look. You can file a waiver, which basically means that you're okay, you kind of agree with the overpayment, you're just asking Social Security to waive the overpayment because you don't have the means or ability to pay it back, or you can just make an agreement to pay it back. And luckily you can set an overpayment agreement so that you're not paying back the entire amount within 30 days, like those scary letters are that you receive. But you can set it so that they can take a limited amount. So it may take a long time to pay off, but ultimately speaking, as long as they're taking the payment out, you'll still get something each month. So it depends on the situation. It depends on whether we can reverse it with a work incentive or if we have to send it up the chain to our Disability Rights Iowa staff. But if you do have a situation that requires an overpayment or that has an overpayment, please let us know. Reach out to us so we can take a look to see if a work incentive is applicable, or you can call our 1-800 at Disability Rights Iowa, and they can provide you information or refer you to the WIPA program if you meet the qualifications needed for our program.
I have another question. Duke it out, whoever wants it. How soon should youth with disabilities start connecting with benefits planning? And do you all work with the transition process?
This is a great question. I'll take it. The sooner the better would be my short answer on that. We have been in schools working with folks 15, 16, 17, and up. We can technically, for our grant parameters, start with somebody with 14 years old. And honestly, work should be that conversation as an inspection, right? That when you're looking at somebody who's starting work early, that's going to benefit not only just in the soft skills that that student is learning about, but they're starting to already earn those work credits, right? So in some cases, even if the student has SSI, there's work incentives that are available to them, so they don't even have to count any of their work up to a certain amount of money. We won't take a deep dive into that today, but the short version is we absolutely do work with transition folks, and the sooner the better. We've done a lot of work with Project Church across our state and other entities that are working with students. We're always excited to be part of that conversation because a couple of things happen. There are a lot of myths out there about how earnings might impact students' income. And as we've talked about today, that income may impact a whole family because according to a lot of, like I mentioned, myths and maybe misinformation, there is an all or nothing sort of situation, and that's not necessarily the case. So we would love to be part of that conversation so that we could walk people through the impact, if at all, of those students' earnings on their benefits and possibly a whole family's budget. When talking about the benefits cliff, it's something that we want to make sure everybody has current and accurate information about, with all of the moving parts that go into those scenarios. So yeah, as soon as we can get into the conversation, whether that's tag teaming with a provider they're already working with, or a direct referral to us, or through the Ticket to Work helpline, whatever that might look like, we're happy to work with transition age youth. That's actually part of our focus under our WIPA grant, and we're happy to do that. I hope that answered the question.
And if there's part that we didn't cover, please put a clarifying in the chat. We're more than happy to answer it further. Someone had messaged, in my work, I don't always know if my clients have a Social Security disability benefit. Are there things that I should ask or listen for in order to determine referring over to you all?
Yeah, I can take this question. So when we're working with an individual, we'll ask them, we also get that. Sometimes individuals just aren't sure if they're receiving SSI or SSDI, or if they're receiving Medicare or Medicaid. So we ask general questions like, are you receiving a check from Social Security? If they're getting their check on the 1st, likely that's SSI. If they say their SSI check is $943 a month, or their check that they receive from Social Security is $943, well, that's probably SSI. If they say their check is $1,300, well, it could be a combo of SSI and SSDI. There's so many scenarios that we're always checking to see if the individual is receiving benefits. But of course, the only way to really find out for sure is for us to get benefits verifications. And that's why we start with our intake materials, our releases, our information sheet, so we can contact the person's services that they receive and determine exactly what they're receiving. We never try and guess, because as soon as we try and guess what somebody's receiving, sure enough, we'll find out that it's something different. So we like to make sure we're 100% correct in what we're talking about by working with SSA, working with DHS, SNAP benefits, housing. What are these individuals receiving? So that, again, they can make the most informed decision possible about their own benefits. And the only way to do that is to get verifications.
Thank you. There was a question that came through the chat, a couple actually. So we didn't actually get to Matt having Medicare. So this is a good question of, he hits those 2 years. Does MEPD cover Medicare premiums?
I will take this one since Matt was my guy here. Yes, actually, if somebody has Medicaid, in most cases, they will cover that Medicare premium. So once in Matt's scenario, once his Medicare kicks in this year for 2024, that amount is around $174. That usually would be reducing that SSDI benefit. But if somebody has MEPD or Medicaid in Iowa, they would most likely be able to have that paid under Medicaid instead, which would put that 174-ish dollars back into Matt's pocket, which is really great. That too can sometimes be a driving force in whether or not that help can be applied with somebody with Medicare and Medicaid.
Another great question that came through, can you work with those who has a disability, recently applied for benefits, and is currently working in high school?
You
Tammy,
got
you're
this
gonna
one?
take it?
Yeah, I can take this one.
Okay.
So yes, as long as they meet our parameters, we can work with them. You know, as long as they're within the age description, they're working or thinking about working, and they're receiving disability benefits, you know, SSI or SSDI or both, then yes, they meet the qualifications for us to begin working with them. And keep in mind, all our services are free. We're funded by Social Security to do this kind of work. So it's very easy to get connected with us and for someone to receive our services. So please don't feel that you can't contact us directly. You know, all our information is on our Disability Rights Iowa website. Someone can contact us through the Ticket to Work helpline. They can contact us through our DRI intake line, or they can just email Jenny, Misty, or myself, and we'll be glad to tell you whether or not they meet the qualifications for WIPA and what those next steps would be.
One thing I will add, so as long as they are approved for benefits, so it doesn't mean they have to be currently receiving a payment. We don't help if someone hasn't applied or needs help applying. They do have to be, unfortunately, already approved, whether they're getting a payment or not. Misty, a question has come in. So we talked all about getting up to EPE. Is there something that happens after EPE? Because you said it was 36 months. Is there something that happens after that?
That's a great question. In keeping of time for the scenario, we didn't get to that third and final phase. So after the EPE, that 36-month time frame, and remember when I said you could go off on, and your check might pause during that 36-month worth of time? After that time window is closed, so on the 37th month, let's say, if that person, in Matt's case, if he works and it's over that SGA amount, the substantial gainful activity amount, then that's when Social Security can say, we're terminating your benefits, that you'd no longer be considered disabled according to their work rules due to work earnings. That doesn't mean disability or impairment has improved necessarily. That just means you can earn at a level that's over that SGA amount. And when that happens, that starts the final clock ticking, where you have 5 years from the termination date forward, if you're not working over SGA anymore. And that doesn't necessarily just mean that you reduced your hours. That could mean your business closed. That could mean your disability has ramped back up and you're not able to do it that much anymore. Then you can connect back with your Social Security's local office and request what they call expedited reinstatement. That is a way for somebody to get their benefits rolling again and not have to do the whole application. So a couple of caveats about that. In order to be able to request that EXR, expedited reinstatement, one, you have to no longer be working SGA level earnings. Two, you still have to be able to prove that you have disability or impairment related to your original disability or impairment that you got on the Social Security rolls for in the beginning. You can't have something new pop up. If you, for example, were on the rolls because you had epilepsy and now you have a back injury, it would have to relate back to that original epilepsy diagnosis that you were on originally. It couldn't be something new. If Social Security decides it is something new, then they would want you to start a whole new application process. But what's nice is during this piece, if they say yes, that there's an EXR request going to happen, you're able to get provisional payments for 6 months while they're making that decision as to whether or not it actually is the same as it originally was, or if you had to make new application. And those payments you never have to pay back. So it's kind of nice that there's still one more safety net, even after you've worked a couple of years and you're off those benefits, that you can come back on the rolls if you need to. It's another great piece to that road trip, the third final piece of the road trip.
I have one final question. Unless there's any other questions, please feel free to put them in the chat. The last question that's come through is, I want my team to hear this information. Do you present to other agencies outside of today?
Do you want to take this one, Misty?
Sure, I can take this. We absolutely can. If you would email any one of us and talk with us a little bit about what it is you want to hear about. We can do a smaller like intro to WIPA, what our team is, what the referral process is, kind of the areas that we cover. We could do that. And that could be virtually, depending on our coverage area and where you're located at. We can also do bigger training specific to a work incentive, perhaps, or if you wanted to run through like we did today, different scenarios, it can look different. So my suggestion is reach out to us, definitely. Any one of us, like Tammy said, no wrong door. Just give us a holler and we see what we could work out, whether that is a virtual presentation, an in-person presentation, what that might look like. We're happy to come and talk to agencies. We feel like the more people who have this correct information, at least at a baseline level, right, could be helpful in those initial conversations, so that if they hear the key words or hear an amount, that they are at least know that they can refer to us and get folks the information that they need to make a really educated decision on what work might have as far as impact, not only on just their general budget, but their family's budget as well.
Well, I don't see any other questions in the chat. Please feel free the last few minutes if we didn't get to you, if there's something that you really want to hear, but otherwise, I'm going to turn it over to Michael to wrap us up and share some exciting news.
Awesome. Thank you so much, Jenny, Misty, and Tammy, for such an incredible presentation, really talking about the complexities of navigating Social Security disability benefits and really looking on how those benefits can be impacting people's employment decisions. Once again, just be sure to check out Disability Rights Iowa's website at disabilityrightsiowa.org for more information about the critical resources and services that they offer to our community. I also want to make sure that we give recognition to Jamie for providing captioning today and Jennifer and Michelle for providing ASL interpretation. We really appreciate their support with making today's webinar accessible. But thank you to all of you that were able to join us today. We really appreciate you taking the time out of your day over your lunch period just to spend some time and learn more about disability benefits. But before I close things out, there are just a few reminders that I'd like to touch on. As Jenny mentioned earlier, if you enjoyed today's event, you might be interested in UpLift's Community Conversation series, where we bring together community members, local experts, community leaders, and decision makers to have very important discussions about the root causes of poverty and the potential solutions that we could be exploring to improve how we meet our community's needs. And so you can hear about these upcoming events by signing up for our quarterly newsletter, which can be found at our website, upliftiowa.org. Ashley's put that in the chat for you all. The way we do this is that we send our invitations out for these events through the listserv we have and the newsletter. So just be sure to sign up for that, and we'll make sure you have access to information about those events when we host them. Also, we would really appreciate it if you would let us know what you thought about today's webinar by filling out our post-event survey. The responses to that survey are completely anonymous, but your feedback will really help us improve future events and conversations that we have. And Ashley just will put it also in the chat for where you can find that post-event survey. And then as an attendee of today's event, you are not only receiving the CMEs or certificate of attendance, but you also get early access to a brand new resource guide that we are calling Public Benefits 101, a deeper dive into Iowa public benefits. This publication was made in partnership, of course, with Disability Rights Iowa and other amazing partners such as United Ways of Iowa, Iowa SHIP, the Des Moines Area Religious Council, or DMARC, Every Step, and Iowa ACES 360. This guide contains a ton of useful information about how public benefit programs such as SNAP, WIC, Child Care Assistance, FIP, Medicaid, and Medicare are funded. It even goes into how these program benefits Iowans, where we show the impacts of each program on our community, in addition to how these safety net programs are utilized across Iowa. We also tried to include some additional resources that folks might be interested in digging into, so be sure to check those out as well. But we hope that this guide is helpful to you as a community member, a practitioner, and even an advocate. So be sure to go click that link in the chat to check it out. But on that note, thank you again for your time today. We will follow up with an email that has a recording of the presentation and DRI slides. But please take care, and we hope to see you all soon. Thank you.